All right, so we're going to talk a little bit about anabolic androgenic steroids, and you'll see where this kind of ties into as we transition to the reproductive system. So the term, you've probably all heard of these steroids, and they are the ones you're thinking of when we're thinking of these like impossibly large individuals like you're seeing here in these images. The term anabolic refers to muscle building. Androgenic means to increased male sexual characteristics. So anything that's androgenic, we're really talking about the effects of like testosterone and types of testosterone. And then steroids are simply a class of drugs. There's plenty of steroids out there that are anti-inflammatories. They are not anabolic, nor are they androgenic. They are simply a class of drugs. So you can have things that are steroids and not one of these bodybuilding types. Okay. So the way that androgenic or anabolic androgenic steroids are going to function, they do have an effect on the brain as well as on the body. So not only are they going to promote muscle building and other male typic sorts of physical appearances, but they also are going to influence the brain through receptors, either androgen receptors or estrogen receptors on the surface of cells. And that can disrupt the way the brain functions. So it can disrupt dopamine, serotonin, opioid level systems. There's many videos out there that say that by people who use steroids, this class of steroid drugs, that they are not addictive and that they can quit anytime, but they just don't want to, which is what addicts often say. So they can cause some psychiatric dysfunctions, and this I guess like anything else will vary as to the prior condition of the individual and how much a proclivity they already have toward certain psychiatric dysfunctions. Someone who's already kind of close to paranoia, it could really make them paranoid. If they already have delusions or other psychoses, this could really put them over the edge. But some of the other main issues are just the effects on the body. It's hard on the liver. It can cause liver damage. A lot of times there's like this real yellowing of the skin or even of the eyes. Like sometimes you'll see in muscle building magazines, even like these people are lifting all these weights, right? They're featured in there, but they're always wearing sunglasses. It's because their eye, like the whites of their eyes, or at least they used to do this, like the whites of their eyes are very yellow. It can cause high blood pressure. It can cause rapid heart rate. It can cause lots of problems with cholesterol levels. It can definitely affect kidneys. One of the other classic signs is severe acne. So prolonged use of steroids is not a good thing. Okay, and like with anything, the effects will depend on the individual, how much they're taking, how often they're taking it, things like that. Underlying health conditions, So some of the ways that it affects males, females, and then young adolescents. So for men, it actually shrinks the testicles because, again, these are androgenic hormones, and the body for a lot of hormones is very, very efficient. So basically, if the body's already got plenty of circulating testosterone levels, or again these androgenic levels, the testes are like, well, why am I producing more? I don't need to produce as much. So it actually will shrink down to a smaller size. And that can cause infertility, reduce sperm count. It can actually cause development of breasts. It puts males at an increased risk for prostate cancer. For women, it brings about male typic growth patterns. So facial hair, right, which we don't have typically. Male pattern baldness. It'll disrupt the menstrual cycle. It can enlarge the clitoris. We'll learn a little bit. The clitoris and the penis have very homologous-like structures. It also not only will it promote growth of things like muscles and some connective tissue. But remember, your vocal cords are just basically connective tissue, so it'll actually thicken them, which will cause a deepening in a woman's voice, right, to more male typic sounding voice. It can affect adolescents quite a bit. If young teenagers are taking steroids, it can cause premature skeletal maturation, meaning the growth plate closes much earlier than it should. So individuals can be shorter. So again, like if they're being taken, especially at a very early age, it can have an incredible effect on growing kids. The effects will be even more pronounced for adolescent females than males. Okay. And then simply people who are abusing steroids, you have to inject them. They're not oral. They're injected often into muscles. And so anytime you do that, you have to make sure you're using a clean needle. Sometimes people, what's the old saying, familiarity breeds contempt. So people, because it becomes so every day, they lose the perspective of, not sharing needles or reusing needles. And so that they're more and more prone to infections, contracting some blood-borne illness like HIV or hepatitis. There's actually a video, let me go back up, about this guy. He was just injecting himself, like I don't know how many times a day, and he got a massive infection in one of his biceps. Maybe it's that one, it looks a little smaller. And it is just gross. Like he filled up, like just look him up. It's like, I think that maybe that link will still work. I think it goes to that. It was pretty impressive. To really give you an idea of like the effects that these can have on individuals, I'm going to ask that you watch this YouTube video. It's about 50 minutes long. You can always, play it on a higher speed. It's a show called Doping it's like, what is it called? Secrets of the Dead or something like that. And the show itself is called Doping for Gold. And it talks about back when Germany was two different halves, East Germany and West Germany. The East German Olympic team actively doped their athletes, particularly their female athletes. So this was going on in the 60s, 70s, and early 80s. And again, the more androgenic hormones that an adolescent, especially female, gets, the more masculine their body becomes. So the video talks about, and it'll interview several women, some of who were taking off the androgenic hormones earlier on because they were already experiencing problems with their menstrual cycles, very painful menstrual cycles, inflammation of ovaries, things like that. So their parents took them off of it, all the way to others who weren't quite as lucky. So this is one female athlete you can see here as she was competing. She's already kind of, somewhat masculine in appearance. And then as she got older, she became more masculine, that she was even having struggles with her own gender identity until she decided to transition to male. And that's who you're seeing now here as an adult. But again, the video does a really good job of talking more about how, again, these hormones given early enough can have a severe impact on the body. And it just so happens that East Germany was so methodical and so well done. They documented what they did very well, that it makes for a very good documentary, and you can really see, again, what these effects are. So please watch that video, take some notes. If nothing else, you're going to learn a little bit about the history of, just people, and like how sometimes maybe we treat one another and we shouldn't. Okay. So with that, I'm going to stop here. And then the next thing that we're going to talk about is this intersection, a little bit more intersection of hormones and our reproductive system.